What are the benefits of the platform?
The benefits of the platform are multiple. So I'll touch on the highlights rather than the full benefits. So, in order to participate in a quality incentive program or value-based care program, and when practices have to achieve certain outcomes, as I mentioned before. Therefore, what we do is allow the medical practice to practice medicine and we take care of the rest. What does that mean? On a daily basis, we provide the practice with their opportunities. So we pull their appointment report and we look at the patients that are coming in for that particular day. We match them with opportunities to close gaps. And in the morning, we provide that list to the practice. So as part of their daily routine, their huddle, for example, before starting the practice, they would know exactly all the opportunities they have in front of them, and they could take steps in making sure that those gaps are closed when the patients do show up. That's a huge one because now the practices don't have to be sifting through lines and lines of Excel spreadsheet on an MSO that was provided by a health plan, and think of a practice that participates in 4, 5, 6 incentive programs. Though this is super valuable, they concentrate on providing care. And what we do in the background is as important. These are the two top benefits of the platform. The very first one is when we do get all the data into our system, we look for errors and omissions. If it is not reported correctly, it's not done. So therefore, it's extremely important to scan through the ICDs and CPTs and make sure that they are complete and accurate. And these are the two terms that we are referring to all the time: complete and accurate coding. Our system does that automatically. And at the end of the day, when we work with the medical practices over a short period of time, 2 to 3 months, they know exactly how to code for every single measure that they're being judged on. And the final one, which is no small feat, you bill correctly, everything is complete and everything is accurate. You have all the ICDs and all the CPTs, and you submit your claim to the insurance company, and you don't have the credit for the quality incentive measure. So that happens all the time. So our system puts a timer behind every line item on a gap in care report and all the opportunities that are there to be closed. They are closed, and right now we're waiting. And when the time comes, and we're still in a waiting mode when we should have gotten credit, all of those line items are moved directly to what we call the appeal. And most of the time, the appeals process is called the supplemental data process. And our system does that automatically. And all those quality incentive measures, all the gap in cares that are supposed to have gotten credit, they are sent directly to the quality department. And usually we get 100% of the credit so long as the claims were received. So these are the 3 top highlights of the program that makes us different.